Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's look at certain specific antidotes. Specific antidotes for their poisoning. First, we look at the antidote for methylpyrazole. For methylpyrazole. So this 4-methylpyrazole is for the methanol and ethylene glycol. So it is for methanol and the ethylene glycol. Next, what we have is the 100% oxygen. 100% oxygen is used in cases of the carbon monoxide, carbon cyanide, as well as methemoglobinemia, hemoglobinemia. So this is for 100% oxygen. Next, we look at ammonium chloride. Ammonium chloride is for poisoning phencyclidine and amphetamine. So it's for phencyclidine as well as amphetamine. Next, moving on to amyl nitrate. Amyl nitrate. So in case of amyl nitrate, it is for poisoning of the cyanide and hydrogen sulfide. So cyanide and hydrogen sulfide. Next, what we have is atropine. So atropine, it acts as an antidote in case of the cyanide and hydrogen sulfide. So this was for amyl nitrate. Then atropine, it is the carbamate. It is carbamate as well as the OP poisoning. Next, you have bupropion. Propion. It is for the nicotine, antidote for nicotine. Next, looking at calcium disodium etidate. Calcium disodium etidate. So this is in case of poisoning of the cadmium, chromium, cobalt. Cadmium, chromium, cobalt, copper, lead, magnesium, nickel, uranium and zinc. So all these metals. This was the calcium disodium etidate. Next, we move on to calcium gluconate. So in case of calcium gluconate, it is for poisoning of precipitates, fluorides, magnesium and oxalates. Precipitates, fluorides, magnesium as well as oxalates. Next, we have the chlorpromazine. Chlorpromazine. It is for amphetamines. Next, desferoxamine. Desferoxamine, it acts for both iron as well as the aluminium poisoning. Then comes the diazepam. Diazepam, it's for the alcohol withdrawal, amphetamine as well as chloroquine. This is diazepam. Next, dicobalt etidate. Dicobalt etidate. This is for cyanide. So previously we also saw for cyanide was amyl nitrate. Here it is again the dicobalt etidate is also used. Next, we have dimercaprol. Dimercaprol, it is also known as the BAL, BAL. So the poisoning, it includes antimony, arsenic, copper, lead, mercury, nickel, as well as gold. So all these, it comes under the dimercaprol. Next, what we have is diphenhydramine. So in case of diphenhydramine, it is for the toxicity of the poisoning of the phenothiazines and related drugs. Diphenhydramine, phenothiazines and related drugs. Then moving on to disodium calcium etitate. Disodium calcium etitate. It is for the toxicity of lead. Then comes the DMPS. So this DMPS, it's for the toxicity of mercury. Next, DMSA, it is for lead. Then moving on, the deep penicillamine, the cuprimine, the deep penicillamine, it's for various metals. Penicillamine, it can be used for copper, iron, lead, not iron, copper, lead, mercury chromate, lead, as well as zinc and arsenic. Next, we have ethanol. Ethanol, what is the poisoning of methanol and ethylene glycol? Methanol as well as ethylene glycol. Next, we have the FAB fragment. So FAB fragment, the poisoning of, it's used in poisoning of the digoxin, digitoxin and oleander T. Digoxin, digitoxin and oleander T. So FAB was for digoxin, digitoxin as well as oleander T. Then moving on to flumazenil. Flumazenil, it is used in case of the benzodiazepam toxicity. Then talking about glucagon. Glucagon is used for propranolol and beta blockers. So propranolol as well as the beta blockers. Toxicity. Next, we have the hydroxycobalamin. Hydroxycobalamin. So hydroxycobalamin is again for cyanide. So we saw various other antidotes for cyanide as well. Next, moving on to the labetalol hydrochloride. Labetalol hydrochloride. So labetalol hydrochloride is case of the hypertension. This is in case of cocaine. Next, moving on, the methionine. The methionine can be used in case of the paracetamol toxicity. Methionine is used in case of paracetamol toxicity. Then comes the methylene blue. So methylene blue is used in case of methylhemoglobinemia. Methylhemoglobinemia. Next comes N-acetylcysteine. N-acetylcysteine. This is used in case of the paracetamol as well as acetoaminophene toxicity. Then comes nalarfin. Nalorphine is used in case of morphine toxicity, N, and it is M. So nalorphine is for morphine toxicity. And then we move on to naloxone or naltrexone. Naloxone. So naloxone is in case of toxicity of narcotics, opiates, as well as it is used in case of the CNS depressants. Now moving on, we look at nicotinamide. Nicotinamide. So under nicotinamide, there is it is used in poisoning of the Vector poisoning and the phenylurea pesticide toxicity. Vector poisoning as well as phenylurea pesticide toxicity. Next, what we have is neostigmine. So neostigmine, it acts as a neuromuscular blockade. Then comes blocking agents. Then comes penicillamine. Penicillamine is for the copper. Next is physostigmine salicylate. So physostigmine salicylate, it is in case of coma, convulsions from anticholinergics. It is used in case of coma and convulsant anticholinergics. Next, moving on, the neostigmine. Neostigmine is used in case of the neuromuscular blockade. Then comes penicillamine. It can be used in case of copper. Next, physostigmine salicylate. Physostigmine salicylate. It is used in case of the coma, convulsions from anticholinergics, and convulsions from anticholinergics. Next is pralidoxime. So pralidoxime is 2-PAM. It is used in case of OP, organophosphorus insecticides and nerve agents. So this is nothing but pralidoxime. Next, we move on to protamine sulfate. So this protamine sulfate, it acts on the PS. This is in case of heparin sulfate. Heparin, it is overdose. Then moving on to Prussian blue. Prussian blue, it is thallium. Prussian blue, it is thallium. Then pyridoxine is going to be isoniazid or hydrazine toxicity. So pyridoxine is nothing but vitamin B6. It is for isoniazid and hepatotoxicity, hydralazine toxicity. Isoniazid and hydralazine toxicity. Next, we move on to the sodium bicarbonate. Sodium bicarbonate. So sodium bicarbonate, it is used in poisoning of the urinary alkalinization. Urinary alkalinization for the salicylate as well as the phenobarbital. Next, we have the sodium nitrite and sodium thiosulfate is used in cyanide and vitamin K in warfarin. Sodium nitrate and sodium thiosulfate, it is both used in case of cyanide. Then comes the vitamin K, it is used in case of warfarin. So this was all about the antidotes and the involved poisoning or metals. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.